And hello and welcome to everyone. The Coincidence Project is delighted to have Chris Mackey as part of our monthly speaker series. And Chris, I'll let you just take it right away.
Terrific. Thank you very much. And thank you all for being here today for this presentation, which is a topic close to my heart. And it's just delightful to see one or two spiritual friends here. I'll refer to spiritual friends later on. But I think this is a very important topic because I think that synchronistic experience or transpersonal experience can represent some of the best in us. But because it can be quite weird and hard to explain rationally, it can be confused with mental illness or dysfunction. Sometimes if people don't understand something, they think that someone must be, losing their marbles or that there's some problem with their mental health. So it's very unfortunate if some of the best in us can be confused with major mental health problems. So I come to this theme with a background as a clinical psychologist. So part of my role is helping assess the difference between, say, mental illness or help identify psychotic conditions from other kind of reactions that people might be having. So I worked for 15 years in a psychiatric hospital or psychiatric hospitals before I worked in my private practice. And so learned a lot about how to differentiate psychosis. And I noticed different situations where at times it could be confused with other reactions. And then I had a personal experience. After having experienced much synchronicity since my early 20s, I had a personal experience of profound synchronicity, which I found remarkably helpful. I think it was some of the best I've functioned in my life, and yet some close friends, especially those with some background medical training, confused my reactions with psychosis. And that added to my interest in communicating more about the difference between synchronistic experiences and psychosis, because I think it's unfortunate if people are less likely to tell their stories to others, lest they be misjudged as being weird or even mentally ill. So in the Coincidence Project, as a group, we encourage people to share stories. Now, why do we do this? It's not merely for entertainment or to pass the time or curiosity. I think it does relate to the best in us, transpersonal experience. I think talking of our experiences can help reduce stigma, help show maybe it's not so weird or uncommon for people to be having these other experiences, which have been recognized by all cultures since they began. Talking about synchronistic experiences can help for a greater understanding of their nature. And I think by us telling our stories of quite weird experiences at times, but often helpful experiences, it can help mental health professionals be more aware and differentiate better. But I think also drawing on synchronicity can be a way of tapping into our intuition further. And in my personal story, I would describe that as tapping into intellectual intuition in a way that helps solve some very challenging problems that I would have described as wicked problems at the time. They seemed almost unsolvable. And the only way I knew how to address them was drawing on synchronicity. I think we can also apply those strategies potentially on a larger scale to help address some of the world's larger problems, whether it be pollution or overpopulation or climate change. I think we could draw more on intellectual intuition. So some of the topics that we'll cover today, including what is synchronicity, some of its benefits, the nature of mental illness, some examples from clients and others, and then mainly my own personal example where I felt that my reactions were confused with psychosis. Then looking at some specific questions or strategies that can help differentiate synchronicity from psychosis. I'd like to say as well, this presentation, it's not mental health advice. If people are experiencing some mental health difficulties, I'll describe the nature of some of that later on. I'm not making any suggestions that people change their direction or treatment or therapy approach. That's something to discuss with mental health professionals. But I hope that this presentation helps inform a background understanding of differentiating transpersonal phenomena from mental health problems. Now, when Carl Jung described synchronicity, he referred to it as numinous experience. What does numinous mean? So we understand it means meaningful coincidence, but it also has an uncanny quality, which also I think can be considered a sacred quality that I'll describe a bit later on. But the numinosity, the uncanniness, leads to a level of weirdness that goes with it. Synchronicity can include very striking coincidences of any type. It can include propinquity, a kind of connection synchronicity. Excuse me. That's when you think of someone that you haven't seen for a long time and you uncannily encounter them soon afterwards. There can be numbers synchronicity or seriality. That's when you encounter certain numbers or maybe symbolic objects repeatedly. Excuse me. Then there can be references in the media. You can think that there's something on a radio program or a TV show that relates in some way to your thinking at the time. Synchronicity can also relate to a sense of a person's presence after death. There could be certain coincidental experiences that the person feels is like a connection with that person who is lost. And then I think that there are other fortuitous events that we can think of in terms of the universe provides. Somehow there's an uncanny solution that comes up for a problem. These are some of the examples. But again, I mentioned a weirdness to synchronicity that can lead people to question it in an extra way. And I think that we also have some of that questioning about any non-ordinary states of consciousness. As Jung suggested, the modern world has become very rationalistic, looking for very rational explanations for things. But there's some of our states of mind and some experiences that you can't readily explain rationally. So just say with the shamanic healers in different cultures, they would have different kind of rituals, and we could look at a picture of a shaman and think that person looks crazy. It's just the non-ordinary states of mind when we have a rationalistic lens that we can be too ready to dismiss as something dysfunctional. As we understand, the shamanic healers were seen as bringing real benefits to their tribe, to their community. So I think synchronicity is a form of mystical experience. And William James defined that in these ways. It's ineffable. You can't put it into words readily. And that's one of the reasons why it could be difficult for people to tell their stories. It can be really hard to explain it in a way that seems sensible, especially when sometimes the devil's in the detail. It's noetic. There's insight beyond the intellect, and that includes precognition. It's transient. It's not as if it's happening all the time. It can be particularly strong for brief periods, and it's passive. It feels like it's influenced by something beyond our will. The way I'd put it, it's as though there's a higher mind or organizing force in the universe. Now, before differentiating synchronicity from mental illness, I think it's worth looking at some of the benefits of synchronicity. Many people feel that it gives them more of a sense of purpose or direction in life. I often experience it as like a tick from the universe that you're on the right track. It's often affirming. It adds to our sense of connection with other people when we experience a synchronistic connection with them, such as thinking of them, encountering them soon afterwards. It helps us tap into our intuition more deeply, because that's partly how we interpret it. And it also is one way of accessing a spiritual or transpersonal dimension in life. I'm not particularly religious, but like about 25% of people in Western cultures, I'd identify myself as being spiritual rather than religious. And synchronicity helps tap into a sense of meaning in life. And when we have a sense of spirituality, we know that that's good for our well-being. There's a lot of mental health evidence for that, and it can be transformative, as I'll describe some examples later on. So earlier in the speaker series, Lisa Buxbaum and I referred to some of the benefits of synchronicity in terms of spirituality. And we referred to Ken Pargament, who outlined some of the benefits of sacred moments. And I often think of synchronistic experience as a sacred moment. which can add to our sense of well-being, purpose in life, energy, relationship satisfaction. And when we see our work as being a calling, that sanctifies it. It's got a spiritual aspect. For me, synchronistic experiences have helped as much as anything else see my work as a calling. I know for many people the same. Or if we feel that a relationship is meant to be, partly because of synchronistic experiences, that can add to our commitment in that relationship. It helps us resolve conflict within that relationship. There are clear benefits. What about mental illness? There are a couple of defining features of mental illness. One is distress. Generally, there's symptomatic distress. Most commonly, that includes anxiety, depression, can be psychosis, more rarely, personality problems as well. The more common difficulties are sleep or concentration problems or irritability, but generally people are experiencing distress. But there's also usually some compromise in functioning. People, through maybe not being able to concentrate so well, or they have more conflict with others, it's interfering with people's work roles, it's interfering with their relationships, and it interferes with people's perspective or judgment. So one of the other notions of mental illness is where people have more limited insight. Now, I think it's a little bit tricky sometimes for mental health professionals to judge insight, because many mental health professionals would just think paranormal phenomena don't exist. So if someone says they've had some paranormal experience, including hearing that a radio program said something that they have just related to and they think there's some connection there, that might be seen to be a lack of insight because it's not recognised to be just a random event. But what if there are events that happen that aren't completely non-random? I think there's some limited insight within the psychiatric and mental health professions at recognising the validity of certain kinds of paranormal phenomena. So that's a complicated one, sometimes judging people's level of insight. But also the characteristic courses of certain illnesses, like schizophrenia, will often, there'll be early signs of it in early adult life. There'll be a prodrome, meaning a pattern of symptoms leading up to it, or pattern of change leading up to it. So these kind of reactions can't just be assessed at a cross-section in time. There's an overall pattern. And so if anyone very quickly judges someone else at a cross-section in time as being psychotic or mentally ill, that can be on more shaky ground. There's more to it than that. Now, there can be an overlap with certain signs of mental illness and synchronistic events. For example, auditory hallucinations are a very common sign of psychosis. But what about the many reports of people who've heard voices, say of deceased relatives? I'll give an example later on. Then the notion of ideas of reference. That's, for example, believing that the radio or TV is giving some specific messages to you. It's seen as a sign of psychosis. But in my experience and many people's, it can be experienced as helpful synchronicity, almost a guide as to how you might manage a challenging situation. And then what about delusions? So false beliefs that people have a sense of conviction about. Well, what if people believe that they've had a precognitive event, that they could predict the future? A number of people from a very rationalistic perspective might say that's a delusion. We know you can't predict the future. Things unfold in a certain way, not influenced by our own mind in any way. And so there can be a confusion between what are common signs of mental illness and paranormal phenomena, including synchronicity. So when we're gauging mental illness, it's very important to consider the impact on the person. Is there a compromise in their functioning or distress? If not, need to be very careful about judging that as mental illness. Now, how might we otherwise understand certain kind of unusual experiences that people might encounter, maybe for the first time in life? People might encounter a run of synchronicity that they can't explain in any rational way, and it can lead people to be very confused about it. And there are a couple of traps people can fall into when they first experience such kind of transpersonal phenomena. And I find it very helpful to refer back to Ken Wilber's work. He had a psychospiritual model where he tried to put those experiences in context, transpersonal experiences. He said that there are certain normal stages of development we talk about, say, in psychology, called egoic stages of development. So there might even be stages from birth, and some people would say even pre-birth. But just say the common psychological stages of development include, first of all, from being impulsive, you learn to conform more. Then, as you develop further, you tend to become more conscientious. A number of people will keep on developing to become more autonomous or independent-minded. And then only a proportion of people will go beyond that to develop a very integrated way of being their own individual person, but still well connected with the society and community. Now, in usual psychological terms, that's about where it ends. But Ken Wilber suggested, no, beyond that stage of integration, there can be trans-egoic stages where people tend to be further developed again if they have certain transpersonal experiences, like mystical experiences or stages of enlightenment. So presumably the Buddha, Jesus Christ, other people we could think of have had certain kinds of experiences that seem to be a development beyond. But basically, what Ken Wilber highlighted and some others have highlighted is some traps that people can face when they first experience those transpersonal phenomena, what we might call illuminations. I think many people on this call would have experienced something like this. I found it very challenging as a young adult in my 20s when I started to experience synchronicity just after reading about it. It was very weird. But a couple of traps that people can fall into. One is to try and block it or deny it. This is too much for me. I can't explain it. I'm worried I'm losing my mind. And people can then close it down. And that's when Abraham Maslow, who talked about self-actualization, he said that's when people can stunt their development if they get too wary of that experience. Alternatively, people can get carried away with their own experience and feel special. I'm having these special experiences. Maybe I'm special. And it can lead to what's referred to as psychic inflation. And so the notion is, how can we explore, be open to accommodate those experiences, but not getting carried away at an ego level and get caught up in psychic inflation? Now, I'd like to mention a couple of examples where people, I think, have greatly benefited from synchronicity, but where it could have been misinterpreted as psychosis. The first example was a client of mine. I've told this story before, but it's such a striking example. He had severe alcohol and drug addictions. I'd seen him for a period of 6 months. And after a period of time, he booked himself into a rehabilitation program overseas to help get off the alcohol and drugs. He later learned that I was writing a book on synchronicity. And it's only then that he told me this story. He told me he wasn't going to tell me about this, that had happened about a year earlier, because he thought it might seem like borderline psychotic behavior. He kept it to himself. He explained, the story involves, as you'd imagine, a blackbird. He said, you know, when I was having a lot of difficulty early last year, I said, look, I know you're in a really bad way then. He said, you probably don't know how badly off I was. He said, I was very suicidal. He said, I was kneeling before a window, looking at the window. He said, I had a pistol. He said, I put the pistol in my mouth. I chipped a tooth as I put the pistol in my mouth. I was about to shoot, but I could look across a tennis court outside the window, I could see a blackbird looking at me. He said, suddenly that blackbird took off at full pelt. It smashed in front of the window, right in front of my eyes, and fell down dead. He said, I took the pistol out of my mouth. He said, I thought, that bird has sacrificed itself for me. I'm meant to live. From then, he booked himself into the rehab program the next week. He was a model patient in that program, got off all alcohol and drugs, stayed off it for many months afterwards, well, years afterwards. Even at 5-year follow-up, he was functioning very well. And he explained to me, I've been getting these messages all my life, meaning synchronistic messages. When I'm in touch with me and my inner feelings, then he talked about good things happening around me. That's my higher power. That's synchronicity. He subsequently functioned so well. He got married, fathered a child, went well, returning to full-time work. No lapses since in at least the 5 years of follow-up contact that I had with him, sometimes in the community rather than as a client. The thing that struck me is he wouldn't have told that story to me, even though I thought I was very open to hearing people's stories. So many mental health professionals aren't going to hear those kind of stories unless we give particular permission for them or seek them out. And that means it'll often be missed, some of the uplifting side of synchronicity. The next story is about a psychologist, someone who I used to supervise. I ran into her at a workshop, a hypnosis workshop, and we were chatting about what we'd done over the intervening 10 years since our last contact. I said to her, I've been writing a book on synchronicity. And she said, look, do you believe in that? Like, isn't it just all like random things that happen? I was confident enough at that stage to say, well, no, I don't think so. I think some things that happen are more than just chance. And just as we were about to sit down for the last session, she made a brief comment about her mother. Now, I thought she had a bit of a story to tell me. And so I followed up with her afterwards, asked if I could call her, and she said I could. I said, look, I thought that you were about to tell me something, when we were at that workshop. She said, well, actually, I did. And I mentioned I wrote up this story for our local paper, the Geelong Advertiser. One way I look to get across stories is with people's permission to write them up in our local paper. Would have had half a dozen stories on synchronicity to look to get these stories out. And to find these stories on our website, I'll mention later on, you can look at our website and then click on the tag synchronicity, and these stories and other podcasts on synchronicity will come up. But this story was about Mary. She described that when her mother died, just beforehand there'd been some unusual synchronicity around that time. But she was very depressed after her mother died. She'd been very close to her mother. And she described that she was so caught up in grief that she was clearly actually quite clinically depressed. Well, this only resolved some time later. And the context was she had an infant daughter who was a very finicky eater. The only way she could get a daughter to eat was to go out to a local park, look up at the seagulls in the sky. When the daughter was looking up at the seagulls, she'd have her mouth open and the mum would drop the food into her mouth. One time at the park, going through this ritual, Mary hears a voice. She thinks that's strange. Then afterwards, unmistakably, she hears the voice again and recognises it as the voice of her mother. Now, this had a remarkable impact from Mary. By the way, this term of hearing someone's voice who's deceased, it's got a term for it. It's called hierophany, as Ken Pargament described. But how she experienced that is my mother is not gone. She's there for me in a different form. She felt it was like a supportive connection from her mother. So she felt a renewed connection with her mother. Her grief resolved, but she didn't tell anyone about it. Actually, depression resolved and she got back to her teaching studies or teaching work. And then later on, she completed her studies in psychology, became a psychologist. It was only when on TV she saw this documentary of Oxford researchers on paranormal experience saying how certain paranormal experiences could be helpful, specifically mentioning hearing the voices of the deceased. It was only after she saw that documentary that Mary told her husband, this is what happened. Since then, she decided she was going to tell other people about her story and encourage them to tell their stories too, because she saw it as a beneficial thing. But my initial contact with Mary at the workshop, I felt that she was a skeptic, saying, look, isn't this just random chance? Had to dig deeper to get this profound story to come out. But I think these stories are so meaningful, it's important that they come out as Mary now views it herself. And the way that she put it is her interpretation was that love never dies. Now, I'll mention my own personal story, and aspects of it are fairly weird, and I can understand how people could confuse it with psychosis. But I sometimes refer to the theme of psychosis versus satori. Satori being transpersonal experience or mystical experience recognized by all cultures across all times, an important theme in the shamanic, the spiritual healing tradition. I sometimes refer to drawing on synchronicity deliberately as supra-rational thinking. If it includes precognition or an uncommon way of solving a problem, an uncommonly fortuitous outcome comes about when you're looking to tap into it, that's over and above rationality. Rather than being irrational, I think of it as being supra-rational. But people could view that belief of having certain extra abilities we can tap into beyond the rational as being a kind of psychic inflation, which we need to also be wary about. In this specific story, I had an intuition that with challenging events that had come up, I'll explain this further, I needed to tap into a different way of thinking, which drew on synchronicity, but also it was almost like a hypermanic kind of functioning, meaning I'd have a higher level of energy. And I'll talk about this a little bit later on. My mother had a bipolar disorder, and I thought I might have some of those genes, certainly not the full amount or as much, so to speak, or not with such a problem with it. But I thought in times in the past, I'd maybe tapped in to like an extra energy, quicker way of thinking that sometimes overlapped with synchronicity. But with dealing with certain wicked problems in my life, I wanted to tap into that energy, but not go overboard and, for example, become manic. And I contrasted this with, I didn't want to do an Icarus, fly too close to the sun, so to speak. Well, the wax melts on your wings and crash to the ground. I wanted to do a Daedalus. People forget the story of Daedalus and Icarus. Daedalus was able to fly and come down to the ground safely, but not going too close to the sun. It was a metaphor for something that I was looking to do in myself with making a shift in my own brain chemistry that I'll describe about later on. And in dealing with this situation, I thought I was drawing on synchronicity and intellectual intuition, which also can relate to spirituality. So here's the context for my weird story. Biggest challenge I faced in my life, and it happened strangely after I found myself doing something unexpected. I was meeting in a weekly meeting with psychologists in my practice. There were at least half a dozen of us in that meeting. And for some reason, I found myself saying, hey, I think at some times in the past, I deliberately induced a kind of hypermanic-like state within myself to deal with very challenging problems. I was mainly thinking of very busy times around university exams when I'd sort of deliberately go without much sleep and I'd get a quicker kind of thinking and I'd manage for a few weeks and achieve a lot and then stop doing that. It only happened maybe a few times in the past, but I thought maybe that fits. And another context, I'd had 2 previous depressions in my life. My early 30s, I was hospitalised for depression, and there's a brief period where the treating doctors wondered if I might have some kind of manic tendencies. My understanding is in the end that they thought, no, that wasn't the case, but it was a question that was raised at the time. And I'd not experienced anything like that since, but I thought, well, look, maybe there was some extra capacity. I had to go into a different state of mind. Anyway, I thought, why did I say that to my colleagues in this meeting? It suddenly dawned on me, because I'll probably never have to use that state of mind again. Never been more stable at work. Everything in life was settled and stable. So what happened then? Within the next couple of days, I learnt my mother was diagnosed with advanced cancer. Around the same day, I learnt that a psychologist had resigned in our practice under what would be very challenging circumstances for our practice, which meant that I would need to take on some of that person's caseload but I also got a sense that my mother might become ill very quickly, and I wanted to spend a lot of time with her, as much time as I could at that stage. So a combination of needing to be busy at work, but also take more time off. So there are unusually high demands. And I thought, how strange that I've just said about this maybe hypomanic potential, because I thought I'd never have to use it again. It's almost like these events were conspiring. Would I need to use that again? Because there are some very major complications I can't go into because they involved family situations. But my mother had a bipolar disorder. There are other complications with family members that meant that managing my mother's had the power of attorney, but also an executor in that situation. And there are likely to be some very challenging situations that would come up in that scenario. And so I thought there was this cluster of events happening that I thought I needed to draw on synchronicity to help me deal with that, which had often helped me greatly in the past, at least be open to it. And what I decided to do is, provided I kept on experiencing synchronicity, I would keep on allowing this process to occur, even if I went into a state that might seem, I called it hypomanic-like. I'd previously been interested in placebo effects and brain chemistry and how we could consciously influence it. And I thought of it as inducing endogenous amphetamines. Now, I've never had speed or amphetamines, so maybe it was a metaphor, but I thought I wanted to induce a state of mind where I could be more quick thinking, creative in solutions, need less sleep, and that's when I commonly experience more synchronicity. So also, I'll tell something about the story. I wanted to give my mother something that she might want as she was dying. I'll tell something about that later on. So I decided on an experiment informed by synchronicity. I thought this strange cluster of events had conspired to lead me to consider going through this process again. I thought if I was going to go through a hypomanic-like state of mind, I didn't want it to be an illness where you have dysfunction and distress. I wanted it to be advantageous. So I wanted it to be more like a wellness rather than an illness. So I had this question, can you do a Daedalus rather than an Icarus? Can you change your brain chemistry to draw on some of those shifts that might look hypomanic or in a manic direction, yet use them for personal benefit? And if so, could I turn it on and turn it off? I'd need to demonstrate benefits of that objectively and building key support. So I kept in close contact with about half a dozen psychologist friends and contacts while this was happening. So I think it was something to be careful about what I was looking to do. So in my story that comes up, some people could think, is this a hypomanic episode? Others could think, was I crazy? Was it psychosis? As a few friends thought. My brother said to me at one stage, your crown chakra is opening up, which is a different kind of account, almost like an enlightenment experience. I was just interested in being maximally effective to address wicked problems I had to achieve certain goals. What I describe will sound weird, I suspect, but I want to mention a proviso too. I had a mentor. For the previous 25 years, every month or two, I'd met with a family friend, an older, very wise character who had the most remarkable synchronistic stories that I'd ever hear, and he had them virtually every time we met. And I realised I'd had about a quarter of a century of mentorship listening to his stories about drawing on synchronicity. So, how the story started off. After my mother had become more unwell and she was hospitalised, I was visiting her thinking, look, I want to give my mother something that she would want. And the thought popped in my head, strange thought. And I remember that my mother had said how my grandmother used to say that someone in our family would be famous. So I thought, that's something I can give my mother. I can fake it. I can pretend this story is true because she'd probably want to believe that. And I said, Mum, she's lying in the bed. Yes, I said, look, you know that story about how Grandma Harris, she said how someone in our family would be famous? And she said, yes. I said, Mum, I think it's me. And she said, you got it. And I thought, well, so far, so good in this, play acting kind of thing. All I need to do is to tell my mum stories about certain theories I've developed that might sort of, have an influence down the track. Excuse me. And then that will help her just feel happy, something that I thought that she wanted to happen. I thought it was a bit of a nutty wish, but I had a sense that she wished that. And can I say explicitly, it's not like I was believing it for a minute, but I thought I've got to make up some stories like this. So I said, hey, Mum, we can influence our brain chemistry spontaneously. Well, I suppose I'd already believed something like that. Excuse me. And I said that I thought that I was likely to help people understand, in a sense, those placebo effects, that not only can we create new kind of chemicals in our brain, and I'm thinking of if you like, endogenous amphetamines, but also we can get our receptors to open or close. So if they're open, they respond to more of this chemical. If they're closed, they don't. So we've got more of that internal control. Now, I'd never heard of that. I just said it. I was just talking off the top of my head to tell a story. But anyway, after a while, I started to believe, hey, maybe this is true. Maybe not only can we create these chemicals, but cause our receptors to open and close. And so I thought it was a kind of intellectual intuition that might have some truth in it. And can I say, by that stage, I'd already experienced probably about 100 examples of synchronicity that was so remarkable, I really felt that I was onto something. So one day, I thought I would test this out further. It was weeks in. My mother had been in hospital for a period of time. It was about 2 months. It was about a month since I'd learned that she was ill, or a little bit longer. I'd experienced so much synchronicity that one day I was going for a jog near my home along this boardwalk. Now, I was jogging along the boardwalk. About at that point, I suddenly thought, hey, look, I'm experiencing so much synchronicity. I bet so many other people do, but they don't let on. I know what I'm going to do. I'm going to do an experiment. I'm going to stop the next person I encounter, and I'm going to ask them if they experience synchronicity. So I was running along this boardwalk. It was around the far end, the far sea wall, a couple of 100 metres further on. I was a bit relieved to see somebody who I'd recognised on jogs in the morning. He'd walk the other way, I'd jog. We'd passed each other occasionally over 5 years, never stopped to talk, but he was stopping doing some exercises on the sea wall. Walked up to him and I said, look, this might be an odd question, but many years ago, there was this fellow called Carl Jung, a psychiatrist, who talked about synchronicity, meaningful coincidence. Do you experience any synchronicity? I was a bit relieved because he stopped, he sort of scratched his chin, he looked up, he didn't just look at me like I was crazy. And he said, many years ago, a department store started in Melbourne called Daimaru. He said, I said that was going to last 10 years, not 9 years, not 11 years, but 10 years. And he said, that's what happened. I thought, wow, this is curious, precognition. Then he immediately added onto that, and a number of years ago, my father was going to be admitted to a nursing home, but there was going to be lots of complications around the sale of his house and things like that. And he said, look, I've just got this sense my father's going to die in 3 weeks, 3 weeks' time. There's no evidence for that or whatever. It happened in 3 weeks' time. Now, curiously, I felt that I'd received an answer to a question I had while I was jogging along that boardwalk, which is for very complex reasons, partly in my executor role and other reasons as well. I was wondering how long my mother might live. And I went home and I said to my wife, my mother, she's going to last another 3 weeks. My wife, who was an ICU nurse earlier, said that would defy medical credibility. My mother did just last 3 weeks. But at that point, when I asked that person, it was just this intuition that what he'd said was meaningful, because I'd experienced so much synchronicity. Now, it's not surprising that along this time, some people thought I might be going nuts. I was seeing lots of symbolism and things that were happening. I was taking photographs of different things that were symbolic. And it was naturally unnerving to some people around me, and particularly my wife. But nothing more unnerving than one day where there was a double synchronicity, one of which was somewhat unfortunate. It started off, I was lying in bed thinking there's such challenging problems dealing with at the moment, but some things, I was experiencing a lot of synchronicity, so I felt a bit fortified by that, but I felt nervous as well about what was to unfold. And I'm lying in bed saying to myself, so I'm a little bit worried and nervous, am I going to be a worrier or a warrior? And I thought, I'll be a warrior. I've got to be bold, keep on following through what I'm doing. Anyway, I got out of bed. Normally, even if I'm at home on my own, I would put on a robe when I come downstairs. But I thought, a warrior doesn't have to bother with a robe. I walk downstairs naked. For the first time ever on the stairs, I saw a sword, a samurai sword, a ceremonial samurai sword that I'd given my son a number of years earlier with the strictest instructions to always keep it concealed. And he'd always abided by that before and since. But I'm thinking, warrior, I walked out and there's a sword on the stairs. This is just remarkable how it fitted in with what was in my mind. Pull the sword out of the sheath, lift it up. And this would only happen one time in about 200 days. Just at that time, unexpectedly, the front door clicks. My wife comes in. There's me standing naked with a sword. Now, I sometimes refer to the cosmic prankster. Sometimes synchronicity can have a different kind of element to it. And I thought, this is going to be too difficult to explain. But that was a situation where I just mentioned, understandably, it can seem like people are nuts, even though to me, I felt that notion of being a warrior, continuing on with what I was doing, was fortified. Now, we had a friend visit. And the friend might have visited anyway, or it might have been out of concern at how I was functioning from any stories that she might have heard. Well, my friend visited, and there was a couple of things with synchronicity here. She was an Australasian expert in bipolar disorder. So if anyone wondered if I was going nuts, it would have been in a manic direction. She's an Australasian expert in it. I say to my friend, I'm really glad you're here because I'm about to do an experiment. It's applying quantum physics to business. So I was thinking of synchronicity in terms of quantum physics, the way that things would unfold. I said, I'm about to meet this builder that you'll remember years ago, a couple of years ago, we had like a contract go wrong. And anyone would have thought I would have no dealings with this builder ever again. They would have thought that our trust was so breached a couple of years earlier, it would have no dealings again. But I said, I'm going to meet this builder and being experiment, but I'm going to meet this builder and I think he's going to solve the biggest problem we have at the moment of finding a builder for our renovation of our new work building. My friend's saying, look, Chris, kind of don't get your hopes up. And I'm saying, oh, look, it's fine if it doesn't work. It's just that I've got this sense that it might unfold that way. I thought it could because I'd called the builder out of the blue a couple of days earlier. No contact for 2 years. You'd think we'd be enemies. And as soon as he heard it was me on the phone, he said, I've been thinking about you from a couple of days ago. I thought, well, there's synchronicity. I said, can we meet on the Geelong waterfront? He said, yes. I went and I met the builder. I came back an hour and a half later when my wife and psychologist friend probably thought I'd gone and drowned myself in Cryo Bay. But I said, the builder's going to do that renovation and he'll do it at cost. If he eventually did that, it saved $40,000. Now, I thought that was a sign of, if you like, good functioning. But I could tell later that evening, talking with my psychologist friend, that she still thought that I was misguided. And as we were having this conversation, and I recognised, no, she thinks I'm like half nuts, if not full nuts. And I had the thought go through my mind, your frame is broken. It was an unusual thought to have. frame, meaning framework, your way of looking at things is broken. Just as I had the thought, your frame is broken, I heard a snap, I think on the word frame. My very slightly built friend got up from the chair and it had a crack in the chair that you can see on that right-hand side. I thought, this must be a thing. It was only a few years later, watching a film called A Dangerous Method. It talked about a conflict between Freud and Jung. And just at a certain point of their conflict, there was a crack in a piece of furniture next to them. And I know that Freud was spooked out at the time, and Jung said, no, it's no accident, it's going to happen again now. And he pointed his finger and crack, it happened just again. Freud was so spooked, he later on said, no, look, that was just a trick. I've noticed in my own house, I get up and I walk around and you hear little creaks and things like that. So he dismissed it. But I learned that there was a term for that phenomenon. It's called a catalytic exteriorization phenomenon, where something in your mind connects up with something happening outside it. Then, and this was an unwanted intervention, so I'll mention all the wicked problems I had resolved. Certain very complicated family situations resolved. It was the day after my mother died, and I'd met with my brother and sister, and there was not just a reconciliation, which greatly helped relationships within our family, going back conflicts for quite some time. My brother and sister had been estranged, and that was addressed. They're no longer estranged. A lot of positive things had happened, but a lot of the concerns I had were settled. And this was the day after my mother had died. And it was around that evening, a few friends came around. And I thought I'd say to them a little bit of what I thought was going on. And one of my friends, after quite some time, I would have been talking for more than half an hour about what I thought was going on, said, look, Chris, we think you're psychotic. And one said, we've lined up a psychiatrist for you to see, to take medication. We know years ago you were in hospital with depression. We don't want that to happen again. We've lined up this psychiatrist. Apart from all the ethical problems in that, I thought, don't you realise that this psychiatrist has completely different views to me? This is like subjecting my mental health, where I think things have gone very well in ways that I cannot explain to you. It's ineffable. It's so difficult to put into words. But all the objective things that I would look at as things turning out to address challenges well, and I haven't emphasised how well I felt connected with my mother over a number of weeks through that time, which was one of my main goals before she died. And other positive family relationships, what had happened. But I felt things that had turned out as well as could possibly be hoped. There was a resolution of wicked problems that I felt a low level of distress, a very high level of function. I felt I'd never achieved better in my life in facing wicked problems, but my friends were going to suggest I see this psychiatrist who would have had completely different views to me. I wanted them to understand what they were asking fully. So I said to them, look, I will see a psychiatrist if I don't sleep well tonight. So I thought if I slept well, that showed that actually maybe I wasn't as dysfunctional as they thought. But I won't see that psychiatrist, I'll see this one. And I mentioned someone to them who I knew they knew would have diametrically opposed views to me on a whole range of things. So I'd subject myself to exactly what I wouldn't want to if I didn't sleep well. But I was confident that I would sleep well that night, and I did, because I felt I'd never handled wicked problems so well. But I didn't know exactly how I was going to turn this process off, even though I thought I would sleep well that previous night, because the things that were on my mind, I felt were largely resolved. I woke up the next morning and I saw the sun rising through the curtains. I thought, if I focus on the sun rising at dawn, and I'll think of pulling myself back into my usual way of thinking within my body fully, and I'll be back to normal. In about an hour, that happened. I felt quite normal. I no longer interpreted events in such a symbolic way. I wasn't looking for symbolic interpretations. I felt very much back to normal. The upshot is I slept well that night and afterwards, no obvious disruptions afterwards. At the funeral, which I was primarily the person responsible for organising, the minister said, "This family is organised," which I think is not a word you'd use if someone was quite dysfunctional. Family relationships were enhanced. Our work situation was stable. The renovation went ahead with the builder. And what struck me is my concerned friends made no reference that within a few days they could see that things were normal, but the cognitive dissonance was such as though it just sort of never happened, or there wasn't anything to be curious about, just left it. But I felt that the experiment was supported. You could do a Daedalus rather than an Icarus. But I wanted to check my ideas further. And there were 3 ways of doing that. Just serendipity, by chance, there was an Australian bipolar disorders conference coming up. I thought I'll go to that and see if there's anything about my experience relevant there. Then for the science, I'd go to an evolution of psychotherapy conference. And then for the spirituality, I'd go to Findhorn, a spiritual community in Scotland, to look to process what had happened. The bipolar disorder conference, I was struck in one presentation. A person talked about a fellow that he knew who'd been manic, who'd seen a shaman. He was saying how terrible shamans could be, because the shaman said to this person, "Look into the sun to deal with mania." The person looked in the sun and burnt his retina. So the story at the conference was shamanic healing is rubbish. Look, this person blamed burnt his retina. And I'm thinking, how curious, this prescription of looking into the sun. Thought, I can't tell all these psychiatrists or others around about my experience, but no, don't look into the sun in the middle of the day. You'll burn your retina. Look at the sun in the dawn or the evening, in terms of an intuitive way of getting back more into your own body. I thought that was curiously synchronistic. At the Positive Psychology Conference, met Martin Seligman, who was a hero of mine at the time for looking to bring a more optimistic prescription to psychology. But I was thinking there needed to be a more optimistic prescription in psychiatry as well, looking at brain chemicals and brain imbalances and looking at the ways that we can influence our brain chemistry. Synchronicity with that as well. Within a year or so, I learned that Seligman, who was the most influential psychologist in the world probably at the time, living in Philadelphia, was coming to live in Geelong, where he did for 6 months, where he and his team did the largest ever organisational program in positive psychology. So I was glad to get a photo with him with his eyes open in Geelong. Again, synchronicity to me was something that bolstered my career so much. This is how I got to meet Seligman and many of his colleagues actually in my hometown and make those connections. But at that conference also met Ernest Rossi, who talked about neuroplasticity, which I'd not heard before, how we can create new brain cells and connections between them with physical exercise and novelty and numinous experience. So synchronicity, numinous experience can lead to neuroplasticity. I thought, hey, some of these ideas about how synchronicity can interact with our brain and mental health, there's some evidence for this. 6 months later, I went to Findhorn. One day I was going on a run. Intuitively, I had in mind this question about how brain receptors function. For different reasons. Oh, by the way, on the start of this run, I encountered on the road, hard to see it there, but there's a big turquoise number 6. I associate 6 and repeated sixes with synchronicity. It's the main symbol I encounter. Also turquoise, the colour of synchronicity, which is why it's in our practice logo at the top left there. So I thought, there's something extra happening here. When I ran past this field, for some reason, with half of it growing a new crop, half of it fallow, I thought, this is a metaphor for growth and renewal. I thought, cells in our body change at least every 6 years. There's some renewal going on that also helps get across the idea of plasticity in our brains. Also, it means our brain receptors will renew. ran past a field of cows. It was earlier in the day. Half of them were standing, half of them lying down. I thought the cows are a metaphor for receptors being active on their feet or inactive, lying down. At that time, it was almost like these shafts of light came out of the sky, and I thought, that's just amazing. It's like a Monty Python image of these shafts coming out of the sky. I took this photo some hours later. But I thought, there's likely something in this. That evening, at a seminar, at this spiritual retreat, a person presenting said how cells in our body can change every 7 years. I'd said 6. And said, I've never heard this before. Receptors, brain receptors, could be active or inactive. I thought, how remarkable. I'd mentioned those, if you like, intuitive insights I'd felt to someone else who was in that seminar, and she just looked across at me thinking, this is just so weird, because we'd experienced so much synchronicity, but it added to my sense of this potential for some internal control over our brain chemistry. Towards the end of that run, I was going along a road and I saw a shaft of light falling on a building. I thought, I've got to go and look in that window. It's 100 meters away. Now, at this retreat, I had a nickname, Tigger, like Tigger energy. When I experienced a lot of synchronicities I did then, it's almost like that endogenous amphetamines idea, like Tigger energy, different way of calling it than, say, hypermanic and putting a negative label on it. I look at this shaft of light, ran up to the building, look in the window, there's Tigger. I thought, with a little roo on his shoulder, which I related to as an Australian. So again, there were dozens more times synchronicity that I'm relating here, but to me there was a theme that was giving ticks along this notion of how we can change our brain chemistry. Then when I started writing about synchronicity for my book, The Positive Psychology of Synchronicity, at first, when I started writing, I was in San Francisco staying at the Mystic Hotel to help me along. During the day, I went for a walk early on, came across the Beat Poets, and then learnt how much they were into transpersonal phenomena, like Robert Blake, the poet, and other kind of things. That evening, I came back to the Mystic Hotel, told the person next to me at the bar about how wonderful this Beat Museum was. He said, hey, I studied the Beats. This fellow lived in Saudi Arabia. He said, I was at the London School of Economics. I did my thesis on the Beat Poets. Felt this transpersonal theme was continuing. A couple of weeks later, I'm still writing in California in Marin County. Became lost on this walk, encountered an older fellow. For some reason, I just thought I'd blurt out I was there to write a book on synchronicity. He stopped, looked around, told me that he'd written a book called The Spiritual Athlete. He introduced me to a Vedanta retreat next door where I was able to access their library, not normally available to the public. Drawing on the library angel, I only had an hour there picking random books off the shelf. I wrote a chapter on that in my book because they were just uncommonly apt kind of themes that came up related to what I was thinking about at the time. So again, these are some of the experiences of synchronicity that I found uplifting and helpful. So when I consider my own experience, was it psychosis or more of an enlightenment experience? Or can you be in a hypermanic-like state with advantages rather than being an illness? To this day, I still consider it my biggest achievement, helped my connection with my mother, helped address work issues, it helped bolster my faith in intellectual intuition as well as synchronicity. Also, I felt it supported my understanding of brain chemistry and how we can turn it on, turn it off. Writing my book, I was surprised to learn that 2,500 years ago, Plato had talked about some similar issues. Plato talked about the difference between madness and divine madness in Phaedrus. And he talked about 4 different types of divine madness: creativity, religious rites, the muses, art and science, and prophecy. Prophecy includes precognition, like that fellow believing his father would die in 3 weeks' time. So Plato was talking about this 2,500 years ago, and yet it's barely entered discussions in most mainstream mental health settings. So this is sometimes referred to in the theme of spiritual emergencies that Stanislav Grof wrote a lot about. I have a blog, Synchronistic Experience, Enlightenment or Psychosis, that says more about that. So to be practical, how do we differentiate transpersonal experience from psychosis? There was a psychologist, David Lukoff, who had transpersonal experience. He suggested these questions. Does the person suffer from a recognised psychiatric condition? So does it fit a certain kind of pattern? Not just someone thinks that it's weird. Do their reactions involve mystical or transpersonal experience? In which case we need to be careful about judging it as psychosis. Is a positive outcome likely? So we're looking at benefits compared to dysfunction. Is there a likelihood of harm to oneself or others? I would add the following questions. Is the person acting consistently with long-held beliefs? As I was through that time, I'd had those beliefs for 25 or 30 years beforehand, certainly for at least 20 years beforehand. I'd had a mentor for many years. I'd discussed them over with. I was checking in with psychologists at the time who knew of my transpersonal experience. Quite a number of people didn't think I was psychotic. Can the person describe a rationale for acting on synchronicity? So I was very explicit with my own rationale at that stage. Is there evidence of a positive or negative outcome? We've got to consider that to the person themselves and what their goals are, not to what someone else thinks their goals should be. And is the person managing with other life demands? So, for example, I managed with unusually high demands at work before I took off more time to spend more time with my mother in hospital. So when differentiating transpersonal themes from psychosis, we need to look at insight, distress, and dysfunction. If there's not distress and dysfunction, be wary of labelling it. But also with insight, this is a slightly tricky issue if many people within mainstream mental health settings don't have so much insight, dare I say, into paranormal phenomena. So this is what we might keep in mind. Those of us who experience synchronicity and transpersonal experiences positive continue to draw on it and use our intuition when we're aware of the benefits, but also look to stay grounded. It's important to connect with spiritual friends, one of whom delightfully on this call, who I met at that Evolution of Psychotherapy conference I mentioned earlier. Use reason, check your outcomes, look to be rational as well, but then be prepared to tell our stories using our discretion, who we tell. But when we tell our stories, it can strengthen our beliefs and the meaning we get from it, reduce stigma. It allows for some scrutiny or questioning, but also important to keep our ego in check. So if we have experiences like this, maybe we're not so weird, but maybe we're not so special either. Many people have these experiences. They might not talk about it so much. There are ways to check our functioning. There are positive well-being benefits of synchronicity, as Ken Pargament described. Separately, it's worth addressing mental health issues if we do have distress or dysfunction. It really would help to be able to meet with mental health professionals who are aware of transpersonal phenomena as well. That won't always be the case, in which case it's especially important to have contact with spiritual friends and others who understand you at that level as well. So I'd encourage people to stay in touch with the Coincidence Project as also part of that grounding and sharing of stories. And I think that through that, we promote further understanding. My book is The Positive Psychology of Synchronicity. I have a website, synchronicityunwrapped.com.au. A podcast called Psych Spiels and Silver Linings, which has at least half a dozen episodes on synchronicity. Thank you. There are the contact details of websites, and now there can be some time for questions. Okay. Now, so let's see. There's actually Juliet, if you facilitate the questions, that'd be great. Thanks.
Sure, thank you. I think you could probably do stop sharing on the screen.
Oh, of course, thank you. Yes.
You know,
Good.
we have a good way to do it is as the person B who has their video off has done it, is to use the menu bar at the bottom of your screen with your mouse and select reactions, and then you can click on raise hand. So I see B, and then after that I see Brian Carr, and you're welcome to come off mute and share your question, B.
Hey, thank you. I don't have my camera on just because for anonymity purposes and recordings and whatnot. I did find your talk very interesting. I can relate to a lot of what you're talking about as somebody who experiences depression and also sometimes hypomania symptoms and has immediate family members that have more severe forms of like bipolar disorder, etc. So that really spoke to me personally. And just I've had many synchronicities sort of alike you have described. So I'm on the same page as you. What I was hoping to hear you talk about is just not necessarily like is it mental illness, is it not, when these things happen, but like these things happen to me more when I am experiencing hypomania, etc. So like more the question of, are people that experience bipolar disorder or schizophrenia, etc., do they experience more synchronicity? I mean, like that's a topic I'm particularly interested in that we didn't quite skirt here, and it's a big topic, right? And but I'm interested in that element. If you have anything to say
Yes,
about that.
look, I think it's a very good question, B, and it's one that I've wondered about a fair bit as well. And certainly looking back, my first experiences of synchronicity, partly they were so exciting in some ways. I think that experiencing synchronicity can also lead to a release of dopamine. And there's a dopamine hypothesis with psychosis that psychosis can partly relate to an excess of dopamine. And certainly when I look to, if you like, draw on more synchronicity in this particular period, 18 years ago, I often associated with a little bit of a hypomanic state, so I allowed more of that to occur. Can I just say over the last 10 years or so, I've often experienced synchronicity in just as much, if you like, without that hypomanic kind of state. And so I don't think it does need to be so connected with that. But I think that there is something almost correlational. I think when people go into non-ordinary states of mind, including hypomanic states, it reduces that boundary or barrier to more fluid thinking. And so I think that there's fluid thinking associated with synchronicity, more fluid thinking associated with hypomanic states or manic states. But I think it actually helps to separate the two. And that's where I think that there's a great advantage in exploring synchronicity whilst looking to be grounded in different ways. And so I think that if there's dysfunction or distress, it is important to temper some of that before looking to get too caught up in the synchronicity. I think that they can be separated further. But for many people, myself included, especially in my earlier adult life, there was often a correlation between them.
Thank you.
Brian, and then after Brian, I see Annie.
A beautiful discussion, Dr. Mackey, and none of it seemed weird to me.
Thank you. It's a Mr. rather than a doctor too. Thank you.
Anyway, part of the reason I joined in this discussion this evening is because I have a dear friend. If you look at the Venn diagram, there is some overlap. It seems to me that people can have some mental illness and yet also be gifted in the ways that you described. So it's not necessarily a bifurcation. So there is some overlap. I know for a fact that the universe has shown me that a dear friend of mine is what we might call schizotypal, but she is also quite psychic and can read my energies in certain ways that people might consider impossible in many cases. Anyway, I had some other comments, but I'll leave them. Let's go to the next person.
Thank you, Brian. I agree with that too, that overlap. Annie.
Well, nice to meet you. I very much appreciate what you said.
Thanks, Annie.
I'm Caucasian. I married an American Indian from Alaska. So a lot of mine is a mix of Western science and also the spiritual from living in a native culture. So I appreciate that a lot of the Western science kind of gets in the way. But one other thing, I write a lot about this, and I realize we're not living in a very healthy, spiritual, mentally healthy world in itself. So sometimes that we may be healthy, but the society that we're in is not mentally healthy. So I live in America and very aware of that struggle. So it just seems like it's good to be aware of that part of it too.
I think that's a very important point, and I think that's one reason why it's important that we explore human potential in a range of ways, including intuition and intellectual intuition and spirituality that tends to get ignored in mental health circles generally, because that can relate to some of the best in us. And maybe we do need to call on other dimensions to help address some of these wicked problems, such as the extreme polarization that seems to be happening in politics in many places, and particularly America. Thank you, Annie.
Thanks,
Maybe
Annie.
Sorry.
Yeah, we'll have we have two more with hands up. Also, since we carved out about an hour and 15 minutes for this session, we're just coming up upon that time. So I know some people may need to log off, and we want to thank everyone for being here. And in just a moment, I'll post a link to our website. And with our Coincidence Cafe, it meets the third Saturday of each month from 11 a.m. in the U.S.'s Eastern time zone, which of course you need to translate wherever you may be. And it meets for an hour and a half. And our next one in September will be on the 16th, and we'll be talking about signs and symbols. So that overlaps nicely with many things that Chris shared with us this evening. And each month we have different hosts join us, and we talk about different topics. The focus there is on time to go into smaller groups and share your own stories and experiences, as well as time to come back in the main group with the hosts and process or share about those stories. And the speaker series will continue each month with new speakers. Next month, we'll have Kat Windsor, and we'll be announcing that topic on Monday. So I hope you're all on the email list. And you can also sign up if you happen to not be on our email list yet. I'll post our link in the chat in just a moment. And you can, as soon as you visit the website, you'll get a little pop-up that invites you to join our email list. So we hope to see all of you at many more of these events. And we're very grateful to our dear colleague, Chris, here for leading this talk tonight and being such an impactful, important member of our board and our community here with Coincidence Project. So thank you, Chris.
Thank you, Juliet, and everyone here. And I'm happy to stay on for 5 minutes or 10 minutes if a couple of other people want to ask questions.
So I see Stacy and Athena next. So Stacy, you're welcome to come off mute.
Hi there. I lower my hand. How do I do this? I'm sorry, I'm on a phone. I related to, I wish I could have you for an hour to myself and pay you. Do you do that? I've had synchronicity my whole life, every way you can imagine. And I also have bipolar 1 with psychotic features. I'm on a lot of medications for it. And I call it like a light switch where I can still experience synchronistic events, but I don't seem to have much control over it. And I'm wondering, see, I don't hold the belief that anyone who is experiencing psychosis, that it isn't just a spiritual experience for them that we don't understand, especially in Western society. And I find it because most people who are psychotic in psychiatric facilities are all saying the same thing. They can kind of build off each other as well. And you having worked in psychiatric facilities and witnessed a lot of people who are psychotic, I can understand what you're saying about them deteriorating or perhaps not reacting well to it. But it seems like if you had a mentor or someone guide you along and ask the questions as to how they maybe got to their conclusions, I feel like they'd be able to explain it. We just, as a society, always, like, you were accused of being psychotic. So
Yes.
Are you?
Yes, look, it's a very thoughtful question to pose, and it's a challenging one, because really in the long run, I think what's so important is that many more health professionals become much more well-versed in transpersonal phenomena and understand some of the complexities of the overlap, but partly looking to be careful, if you like, or partly looking to be a tad conservative when focusing on this topic. I think in the first instance, if people are experiencing distress or dysfunction, it does help to look to find ways to ground oneself or temper that as a priority. Now, I personally find it can make all the difference with that too, if you have at least spiritual friends that you can communicate with, or people who understand that other, whether it feels like an unconventional part of your way of looking at things, when in fact many people have transpersonal views. It really helps to have spiritual friends, at least, if not also health professionals who can relate to that kind of dimension. So until many more health professionals do understand and relate to that dimension, which probably allows more exploratory conversations about the overlap, if you like, between transcendent experience and mental health problems, I think it is important to also have ways of looking to be grounded, of looking to find stability in your life in certain ways as well. And look, I hope that goes some way to responding to your question, but I think it is tough when people are having experiences that also have an element of, dare I say, valid transpersonal experience. It's especially hard to be understood if people also have some mental health difficulties associated with that. And that's what's worth looking up the work of Stanislav Grof on spiritual emergencies to get a little bit more idea of that as well.
Thank you.
And we have Athena next.
Hi, yeah, so my background is actually, I also have a psych background, but in relation to this topic, I actually keep a Google Doc called the Matrix Report, where I have coincidental things happen almost every single day, and I post them on Facebook with pictures of things that show I'm not just imagining that I saw this. I actually saw this, and I have pictures to prove it. And I usually have things happen with other people there with me. For example, today we saw a group of us went to see Golda Meir. I don't know if you've seen this movie yet. Have you?
No, I haven't.
So when you go to see this movie, if you go to see it, it has birds as the symbolism at the beginning and the end of the movie. And I could not help but notice that your book has birds on the cover.
Yes, I like that very much, how they put birds on the cover. Yes.
Yes. And you will see sort of a scene just like your cover in the movie, as such that I was confused as to what exactly the symbolism was when it looped back at the very end with the birds. And I won't say how the birds were at the very end because you haven't seen the movie, but it was the one thing I Googled because we were all a little puzzled by it. So for the last thing that I Googled today to be symbolism of birds in Golda Meir, see birds on the cover of your book. I just thought it was a little odd. So you will be part of my Matrix report today, just a part of it, because there's already other things in there for today. And thank you very much for the talk.
What wonderful, Athena. Thank you. Just a couple of things to mention. It's recognized that in the artwork of people with schizophrenia, you very commonly see birds. And so that means that in artwork, it was often almost interpretive. People are painting birds a lot. Oh, that might be a sign of psychosis. But by the same token, birds are very much a transpersonal symbol because of all the animals, they most obviously link the ground and the sky, so heaven and earth. And so that's where birds particularly have that transpersonal kind of aspect to them, whereas snakes also, to some extent, like in the ground, like underground, at the base of the ground or up in a tree. That also adds to the transpersonal notion of snakes. But birds, it's particularly, I think, the fact that they can be on the ground and they can fly, that adds to both their transcendent aspect, but wondering about the overlap between it coming up so much in the art of people with schizophrenia and a transpersonal symbol, it does lead us to wonder, doesn't it? It gives clues that there might be overlap when we're looking to go beyond a usual rational way of being, whether it be in a more healthy or beneficial way or something which looks very dysfunctional. Those states of mind might have a little bit more overlap, which I suspect is also tapping more into symbolic or intuitive or non-ordinary states of consciousness.
For me, I just think it's that I'm more observant than most people.
I think you probably
because
are.
I just observe them. Like, I suspect a lot of people who would have seen that movie today, if they had seen the cover of your book, they would have never thought, oh, there's birds on the cover of his book, and birds were the symbolism, the real symbolism in the movie. So.
Just so a brief story. A client I saw with schizophrenia, he'd often see 3 birds. He's also a very spiritual person, but he's very common. He'd tell me these stories of seeing 3 birds. And I asked him one day, what's the symbolism of the birds to you? He said, Father, Son, Holy Spirit. He related to his spiritual beliefs. When I was in California writing about synchronicity, there were some uncommon situations came up where I saw 3 birds. It tended to come up again and again and again. And I felt that was a symbolic and synchronistic connection with that client. I told him about that. And when he, being someone with schizophrenia, really appreciated that, because I know that he knew that I saw him as a fellow soul traveler, not just as a schizophrenic.
Thank you. I see S, and then Annie and B have both put their hands back up again. So S, if you'd like to come off mute.
Hi.
Hi, S.
So I'm going to try to not take too much time to explain my comment / question. But it feels a little bit, there's a lot of moving parts in it. So I am an artist. My sister suffers from schizophrenia, but I've also always been a very spiritual person, and I've never had a psychotic episode or anything, but I do have these sort of heightened states of awareness, so to speak, where there's a lot of synchronicities and I can tie a lot of connections into my life. And I've always sort of wondered if there's maybe just a sense of my sister losing track of all of those synchronicities to a point where it becomes overwhelming for her. And then I just wanted to share a story. I recently was driving across the country. I live in Canada. And I lost my cat along the way when I was camping. And I recently recovered him. He was found by some locals. But during the process of trying to find him, I was just looking for some sort of encouragement. Like, do I keep looking for this cat? I was hiking around in the forest by myself. I drove into town for some supplies, and there was a sign on the highway. Someone had spray painted, "He is coming back." And so I thought, well, I guess I better keep looking for him. And sure enough, 2 weeks later, I have him back in my life. But I guess sort of my question is, as a result of going through this kind of traumatic experience with my cat, I have been having some anxiety and like feeling concerned. And I think that's a normal reaction to a stressful situation. But I'm trying to sort of figure out, if you're experiencing synchronicities and having anxiety, is that just enough to say that it's no longer a synchronistic experience? Or because I think these things can happen at the same time.
Yes, I think that's a very important point. And that sounds like a very valid experience of yours, because you saw that message about his coming back, your cat comes back, that's validating. So you've got some evidence that the synchronistic experience and how you interpret it worked. Now, the thing that strikes me is often people experience some anxiety, dare I say almost unnecessarily, as almost a cultural impact from people being too questioning of those weird experiences, if you like, and almost a suggestion that people might be losing their mind if they believe in that, because we can't explain it so rationally. The thing I'd encourage people to do is go on your experience. If you have an intellectual, intuitive interpretation of something, and then it comes true, I think it's worth noticing that, because I think it's tapping into whether it be certain kinds of, whether we call it precognitive abilities or intuition. Maybe there are ways that we can kind of process information beyond which we can explain rationally or readily, but they kind of still work. In my experience, I make lots of life decisions partly influenced by synchronicity. And you made the life decision to, like wait and still look for your cat. So if it keeps on coming up trumps, I think it's worth keeping on doing that. And by telling our stories to each other, hopefully there's less anxiety overall just because it seems weird. As we get less anxiety about that, hopefully we can experience these transpersonal phenomena in a more confident way and talk about it, that again can reduce anxiety about the weirdness of it. But if, as well as that, people are really struggling in their lives in different kind of ways, it is important to look to address that component, I think, and not just think, oh, because I'm experiencing synchronicity, I can ignore all of that. But it sounds to me that some of your anxiety was a common anxiety about, is this odd? Is this weird? And maybe it's way less weird than it seems.
Yeah, I think I tend to be more concerned about, is it weird, because I know what my sister struggles with. I think, I have friends who are spiritual who don't have family members who have struggled with psychoses, and they're just like, just trust it. It's just spiritual. It's just a spiritual experience. But I think I tend to be concerned on either side of that.
Okay, look, I'll just mention, I think often those concerns are exaggerated if people have family members with psychosis, but they function quite stably and well. There's a degree of loading of psychosis in my family, including my immediate family, but I was confident from 30 years ago when I recovered from a depression, I'd never get depressed again in a day of my life or probably have any other mental health problems, and I haven't. So it's not just whether you have a genetic loading or whatever. If you're going about your life in a certain way that has meaning for you, feels relatively stable and all the rest of it, then the risks of developing an illness, mental illness similar to what siblings have, is much lesser. So again, I hope people have more confidence in that if you're finding the way you're living is working for you.
Okay. Yeah, thank you. It's wonderful that this event is happening right when all of this is on my mind.
Great, Yes. Great you turned up. Thank you.
I'm glad your cat came back. I'm sure
that's wonderful.
Yeah,
good story.
Thanks.
And then we have Annie again, and we probably can wrap up just after that.
Sure.
Well, getting back to the birds, Forrest Gump starts with a feather and ends with a feather. And maybe one of the things to realize is birds see it from above. I learned to fly when I was 16. And when you're above, you're seeing everything connected and how they fit together.
Very good. I know a number of people who relate a lot to the image of feathers, and one who's on this call earlier. And it's a common synchronistic symbol for many people, I believe.
Yeah, well, thank you so much, Chris. And thank everyone who's taken their time to be here. We're really grateful to have your wisdom and expertise, and to be able to bring people together here as part of the Coincidence Project.
Thanks, Juliet. And I can just say it's just so wonderful to have spiritual friends and a group like the Coincidence Project to connect with. Delightful to see here. A close spiritual friend of mine, Danny. Thank you very much for coming along today, Danny. And wonderful that you could all be here as well. And thank you, Juliet.
Thank you, everyone. Until next time, love to see you at a future gathering.
Bye then.
Bye.